information. All right. So just going to go over the agenda for the day really quick. So we're going to talk a bit about reporting and some of the evaluation activities that we have going on. And then we will open it up to all of you to go over the slides that y'all sent before today's session. So all of that is added in, and we'll kind of spotlight each of the backbone agencies and their regional health equity councils, have a brief break, and then go over kind of just some overall updates, talk a bit about kind of PA, things like that, and answer any questions that y'all have for us. So, Lindsay, do you want
Hi, everyone. Yeah, thanks, Danielle. So for the next few minutes, I want to talk with you and just go do a little bit of an overview of the reporting form based on the information that, I've been seeing as reports come through. I realize that there may be some opportunities to provide some additional support and make sure that you have the information that you all need in order to be most successful at really communicating your story to us so that we can in turn take that story and then communicate it upward to the CDC. So I'm going to go ahead and share my screen. And I'm going to pretend for this purpose that I am a backbone organization that is trying to complete this report. And so I'm going to pretend to be Access Health today. And so for this, I'm going to just walk through some of the common challenges that I see. And then hopefully at the end, there'll be a little bit of time to ask questions. I also wanted to highlight that tomorrow we do have office hours from 3 to 4, and I'll be there and can offer any support that you may need regarding submitting your monthly reporting that is due on Friday. And as always, I'm always happy to jump on a call or take a look at a report before you submit it to see if we can help troubleshoot anything, or if you're not exactly sure, if you check the right box, I'm definitely happy to support you all in that way. So just so you know that support is there, you just have to ask. So for this one, we'll be reporting for the month of January and the activities that you did in January. I'm in this case and scenario, I pretended like we had 2 meetings and that we talked about scoring and mini grant applications. And so for here, when we're talking about activities that were accomplished, we don't need like huge paragraphs, but we do want to know, what you did, including the successes and challenges that you shared. And so this can be sort of like bulleted little things. They don't have to be huge sentences, but we do want to know successes and challenges that you experienced so we can get that complete picture. Then we have planned activities for the month. And then if you see any barriers, including, staff changes or changes anticipated to the budget or.
Lindsay, would you be able to zoom in a little bit?
Oh, yeah, sure. Let me see. Can I zoom in?
Yeah, hold control and
Control plus.
Yep. There you go.
Is that better?
Yeah.
Yeah. Okay. Awesome. Thank you so much. Okay. So if you guys foresee any barriers or any sort of roadblocks, let us know, and then you'll have opportunities to enter that information. This particular performance measure is the one where we see folks having the most maybe confusion or needing some more guidance. And so I just sort of want to walk that through with you all. So if your partners or your mini grantees did any work in developing or sharing the mitigation prevention resources and services, you would say yes. And then I know that this can be a daunting and scary list, but I also want you all to know that if this wasn't something that you did, you don't have to feel like you compelled to check every box. So we don't want you to feel like, oh my gosh, I didn't do all of these things. Does that mean something bad? No, that doesn't mean anything bad. It just means we needed to present a wide variety of options just because folks are doing different things. So if this doesn't apply, or, we didn't do testing resources, that's totally okay. You click the one that does apply. Oftentimes maybe you communicated different things, and then there's going to be boxes that open up so you can briefly describe what it was that your council actually did. So that was an additional feature because we realized that we couldn't thoroughly describe some of the activities. So we wanted to provide a place for you all to enter, what work that you did in the different areas. These top two are the ones where if you do select them, there is additional measures that open up. So we're going to walk through this particular one. So if for performance measure 1.4, if your council indicated that in the past month they had provided access to testing resources and services, then this would open. And so when we're talking about the total number of resources and services provided, we're not talking about the number of people served. We're talking about the number of services or events or resources that were provided. So for example, if your council helped with one mobile testing site, and then they also helped with one partner event, that would be 2. So you could say, okay, we provided 2 testing resources and services within the previous month. And let's pretend for this example that these 2, the mobile testing and the partner events, we're targeting. Now, I know this is not a huge population in Michigan, but the Alaskan Native population. So let's say these services were targeting the Alaskan Native population. So we did both. We did mobile testing and partner events, and they both targeted the Alaskan Native population. And then we know when we track that we served approximately, let's say 100 folks at this event. Let's say the mobile testing took place at a local health department. And then maybe also a community organization. And we partnered with the local health department staff. And then the information, additional information like the names you can enter in here as well, but this is just an example. So that's just to sort of get you to see that for this number of services provided, we're talking about sort of the categories of things that were provided that you checked here. And then underneath the specific population of demographics is what we're looking for, like the number that we served. So we sent out 100 test kits, or we went to a partner event and we helped, provide support to 100 individuals. So that's just an example. And then I'm going to scroll all the way down so you can see that after that, we really want to know and have you reflect and report to us about the successes and challenges that you experienced when you guys were providing those resources and services. So, maybe you really strengthened a partnership, or maybe you didn't communicate it as effectively to the community as you'd like to. And that's perhaps an area where we could provide technical assistance. So really just thinking through that so we can communicate that up on your behalf. And also maybe it gives us a point to consider, hey, we're seeing that a lot of the backbone organizations and the councils share this common need. And that way we can try and be as responsive to that as we can. The same concept applies to the access to vaccination resources and services. So that same idea of how many resources were provided, who did you serve, approximately how many did you serve, the setting, partner mobilized. And then I'm going to scroll down here, so don't get seasick. I apologize. So additional change that is going to pop up in 2.1 and 3.1 is we're going to ask you for counts. So for example, if you say that you and your partners work to improve data collection quality and reporting, and you say, yes, we improved data collection, and then you decided that your council really helped do some implementation of improvements to testing and contact tracing, how many improvements was that, was made to that area? So it's like, oh, well, we made one really big improvement. And then you can explain down here. So what was it that you did? So you'll see that pop up as well. And that is true for each one. And if it was like, you know what, none of these really apply, but we did something else that was really cool, you click other. Okay, we did 2 things, and then you would explain them. And that's true. We're also going to ask that of 3.1 as well, infrastructure improvements. So you can see that it will pop up and you'll be asked to tell the number of whichever one applies. And if you did more than one, feel free to check all that apply and then go ahead and explain what it was that was done. The last piece I really want to touch on is the partnerships and collaborations. And so I know that a lot of you have awarded different mini grant organizations and are funding new mini grant recipients. And so those, if they're new partnerships, then that would be a great opportunity to say, yes, we created new partnerships. You would briefly describe, what happened. We funded the mini grants. These are the folks that were funded. And then we're going to ask you to provide counts based on the sort of category that it is. And the thing to remember, and some of you are like, Lindsay, we've seen this a million times. That's okay. But just want to know, once you report this partnership the first time, you don't report them again. So, let's say this month you were awarded 10 new mini grants and you report all 10. And then the next month, you aren't reporting them again unless they change in scope. So let's say the contract has adjusted and now they've expanded their work in a different way than was previously thought, then you would report them under expanded partnership. But we don't want to see them reported month after month after month. So you provide that snapshot the first time and capture them. And then the next time you wouldn't report them again unless something has changed and shifted. The last piece is the council TA request form. So if your council is really feeling like they maybe would like to have information about data request, or if they would like a training on health equity, or if any other sort of thoughts, we have this form that can be filled out and there's some options on there, but please know that you're able to request other things other than what's on this TA form. So if your council really has an interesting request that isn't captured in that form, please let us know. Provide as much detail as you can, and then we will set up a separate email to talk through logistics and try and make sure that we craft something that meets your needs. So you'd fill out the form and you'd email it to both myself and Danielle, and then we will schedule a time and set up a time with you to talk through logistics. And so I'm gonna stop sharing. Actually, before I stop, maybe I'll pause and see if there are any questions.
See a question in the chat, Lindsay.
Oh, sure.
From Heather. She's asking, are you able to increase the size? Oh, never mind. That was about increasing the size of the document.
Thanks, Heather. Thanks, Danielle.
Lindsay, I do have a question. This is Michelle from Macomb County.
Sure.
One of the things that we are doing around improving data is to do surveys. And so I am wondering if we're sort of all having our mini grantees sort of collect these surveys, how do you capture that? Is that a single event, or maybe that's a TA question for tomorrow, but is I will capture as one event as the question.
Is it one survey that was developed?
We've developed a multilingual survey, so it's going out to all different partners and they can they all have the same questions. Yeah. I
mean, and Chaharu or Danielle, you can tell me if this is wrong. I would capture it as one event, one survey. Would you guys agree that seems?
So survey to collect what information and for what purposes will help us understand where it goes.
Okay, so for example, the Macomb County Community Health Survey that was done by the Health Department acknowledged that they primarily only surveyed community members that were white and upper middle class. So we're trying to make sure that survey with similar questions are broadly disseminated to a more diverse population economically and racially.
So it is an improvement of a data collection effort that you have, you would say. Then yeah, I would count it as one, unless you have a very specific population that is counted as one. So like this survey needs to be reached to this particular population, and you have a multiple priority population that you can make a claim for, okay, this count as 3. because it is like we have a goal to reach these population. So if that's the case, you would write that in as a part of a priority population. We created this. If not, like your overall goal is to reach different groups. If that is the goal, I would count as one.
Okay, that's really helpful. Thank you.
Yeah, and also make sure if you do have questions, anything specific like that, we have our office hours tomorrow and I will be there and be happy to walk you through any questions. So, all right, back to you, Danielle.
So the next thing we're going to talk a bit about is we're going to have Shaharu talk about the evaluation. So I'll just go ahead and pass it over to you.
Hello. If you haven't met me, my name is Chiharu Kato. I am a part of the evaluation team that works within OEMH for this grant activity. Today, I want to talk about the Partnership 101. Okay. So before going on this slide, I would like to talk a little bit about what happened on the last collaborative meeting where Danielle shared a power mapping tools. And if I remember correctly, a lot of you had an interest in doing so or start sort of thinking about doing similar things. After that, I thought this is really a nice timing to introduce this so that I can get what I want to get and also you can get what you want to do. So let's talk about the partnership. For this grant and for your council, it's all about creating a partnership and leveraging your partnership to achieve your goal. To do that, we want to have a way of measuring your partnership. So just to say that measuring partnership, it comes with a lot of strings. So I want to make it as simplified as much as possible, but start with why do we have to measure the partnership? So measuring or assessing your partnership can help you to, for one, tracking. So keep track of your partnership and collaboration. Two, by keeping track, you will start seeing your patterns of your collaboration. So identifying your strengths and point of improvement. Then the three, if you identify strengths and points of improvement, you can also start strategizing how and who to outreach it for another collaboration partners. Where to start is very simple. Creating a list of partners. I've worked with a lot of organizations doing this partnership evaluation. In many ways, a lot of people do remember who they have or who they work with, but it's a very rare, it is almost rare that I see a list of partnership always tracked. So creating a list of partners also help you to try out the power mapping. The first step of doing any sort of assessment is to know who you have and who you want to have for the future. And as an added bonus is because this grant asks you to report on your collaboration and you report on your partnership in performance number 4. This keeping a list will help you to do the reporting. The next slide. So then, how do we start? The first step is really to create a list of your partners. The second, so once you start identifying all of your partnerships, you start adding organizational or individual attributes. Attributes is the term that I use for the networks analysis, but it's basically a characteristic of the organization or individual. Adding the timing will help you with the performance measure reporting, because you have to be very specific on when is the new partner came, and then you don't report on the same partners. So added a timing of when you start working with them. And then the relationship attributes. Again, another attributes, but this time it's going to be a relationship characters. What kind of a relationship do I have? Next slide. We do have a tool. We have a template, and I am going to drop in the chat. Okay, let's see if anybody can see it in the chat. You don't have to open it right away, but, and also this is going to be, thank you. This is going to be shared alongside with the video and slides for today. But basically what I am asking for is your team to meet and start listing, who do I have as a partner? Are they a council member? What sector are they in? This sector is the same list of an organization type of the performance measure. So again, that would help you to keep the count. Relationship type here. Are we required to use your template? It would be nice. I would like to aggregate. I would like to add everybody's in. If you have your own template, or if you have your own, I think you can copy and paste. But that's what I would ask for. If that is too much of a trouble, let's work it out. If all of the things that I am asking for is there, then maybe we can enter it on our own. So please take a look across and see. I know that you have a list of a name that was submitted to the team before. Some of the information may be missing from there, so it is almost like you already have some basis to it, and then we are asking for additional information. Next slide. So what's the next? So as I said, this is part of our evaluation activity of a council itself. So I would ask everybody to submit back to us. I will combine and create one big map and a small map for each of you. If you need a support in filling out this worksheet, the worksheet itself is very self-explanatory. So if you don't need any support in completing that, that's great. If you need a little more like a walkthrough of what do you mean here? What do you mean there? Please request for a TTA or come to the office hour, but please give us a heads up if you want to talk about this, and sort of a side-by-side, like this is what we have, this is your template, how do I do this? That kind of thing, so that I can put it on my calendar and make sure that I will attend. What is the benefit of doing so? Mino, can you tell me a little bit more about your question?
Yeah, I just, I feel like we're being asked to do additional things, and we already have a lot on our plate, and we're nearing the end of the grant period. So like we already have a Excel sheet that looks at who's on our council, who are many grantees, who are our partnerships by sector, and like, I just want to know, like, what's the benefit of using this particular template, maybe for MPHI, not just for us, but for MPHI, like reporting that information, how will it be utilized?
Sure, that's a good point. And again, if you have the same information already collected, you can share that. I think that if my template will have a little more information about what information being exchanged and something, so that relationship attribute may not be there in the original count or original the Excel sheet that you're keeping. The benefit is going to be the OEMH being able to create the whole network, how an OEMH, like from the Office of Minority and Health Equity Health side of evaluation activity. So it'll be benefits for both. If the council has not been done anything about the partnership evaluation or keeping track of it, that'll be another one. This will be an opportunity. Nearing the end of the grant period, I think Danielle is going to talk about it today. So let's pose that as a timing of why are we doing this at the end of the grant time. Did I answer your question?
No. I
Okay.
mean, I'm trying to figure out, like, yeah, how MPHI is gonna utilize the information beyond May, like, is it just a reporting requirement for MPHI, or like, are you gonna use it in some way that then you can turn it back around to us to help support us further with our work in the community?
Yeah, so I think it'll be both. We will give back a partnership map. Ideally, we would like a 2 time point so that we can also demonstrate the growth of the relationship, growth of your partnership. That's usually one of the strong point that you can use for leveraging for the future funding. We have an ability to support this group, or we have an ability to leverage our partnership to achieve the goal. As a final product, or the wish list for the MPHI is not just for the reporting, it is more of the information given to the Office of Minority and OEMH for their own programming and then the support for the future grant.
Thank you.
So filling out the form, filling out the template, I think we can talk about this. Please request a TDA and we can work through this so that you don't have to do a multiple time, or you don't have to do it twice or 3 times for the same thing.
I just wanted to expand a little bit on what Chihara was mentioning here. So as we've kind of talked about a lot throughout this grant process and working with everyone, is partnerships has been a really heavy piece that we've really been leaning on and really looking closely at, really trying to understand a bit of how can we best continue to build that outreach and identify other opportunities for capacity. So looking at kind of the benefit pieces to you all as backbone agencies is to really provide some picture and really show the growth that you all have been able to generate through your councils, through your council priorities and activities. And I know that right now it sounds like a lot of work and pieces, but like you mentioned, Minu, and I'm sure a lot of other folks have thought about, is pieces of this are here. So really some of it may just be taking the list that you already shared and just adding in, this is the sector for that partner, and maybe what other additional activity or attribute, as Asharu named it, that they are participating in. So it's not that we are trying to create a larger ask here. It's simply asking for a little bit more detail about some of those relationships. You know, as we go to set up check-ins for March and April, and even folks that we're still meeting with this month, we can set aside some of that time to pull up your current lists and kind of work through some of that, answer any questions that you all have. Shahara will be at the office hour tomorrow, so you can ask a few questions there as well. So we'll send out the document and tool there. We'll also put it on Padlet, and it should be available in those spots. Just want to go through some of the questions. So Carrie asked if there was a due date for this document. We're looking to get it by the end of February, so the 28th. And, you know, as always, let us know if you have any concerns or things along those lines around the timeline. And then Michelle asked, is this submitted with monthly with our current reporting, or is this to assist with sustainability planning and evaluation at the end of the grant and to be submitted once? So this won't be submitted monthly. The goal is to at least have one time point that we are able to kind of capture this picture and kind of support the long-term planning piece. So kind of these asks that we put forward, like the spotlights and getting these lists together, the hope is to help folks kind of transition a little bit into the sustainability plan and look forward. And, you know, really the human capital, the relational capital is a piece that sometimes can be sustained in a way much more beyond grant funds and, you know, just looking forward. So I don't know if folks have other questions that they want to ask about the evaluation, about reporting. Happy to answer any questions as they come up. All right. I think next is the spotlights. So we asked everyone to complete a SOAR analysis. So to kind of take a look at your strengths, your opportunities, aspirations / goals, and the results, or what that would look like. And then we're kind of allocating about 6-ish minutes for everyone to share their slides and kind of tell folks about their councils. So I think we're starting with Detroit. We may try to take a break halfway through just to be mindful of everyone's needs and whatnot. So we'll go ahead and start with folks from Detroit.
Hi, thank you, Danielle.
I think this would be Moses. So Dabo is
Wayne County.
Yep. So I think Andrea, I saw you in the participants. If you just want to unmute yourself.
I'm here. This is Chandra.
Oh, hi, Sandra. Thank you.
So good afternoon, everyone. In terms of our SOAR analysis, We had a little bit more of a working with partners in the past, but we are pleased that we were able to seat our 17-member Health Equity Council. We are working with them literally in terms of supporting their development of health equity knowledge, meaning to share the different areas of expertise that they have amongst themselves, as well as to create a shared understanding and language around all of the work. Also continuing to work with them to literally be a community, build a community, and to also support their leadership of their work, as well as the overall focus really has been on the creation of a Detroit health equity agenda. We did want to just briefly lift up that we did go through a fairly extensive process for their selection, which included having a in-depth confidential questionnaire, as well as kind of a blind evaluation of how we prioritize the candidates, so that it was literally based on just the wealth of experience and knowledge, connections, and the different ways in which they personally and professionally relate to the key issues associated with health and health equity. So we are, very excited to be working with our council, because it is literally diverse in every, area. In terms of the opportunities, we are planning a retreat to really, again, continue to support them being a team, as we are looking for them to not only work through the conclusion of this grant, but we also are, looking for them to continue to be working together, learning together, and supporting their long-term influence making as individuals and as a group. We have been looking at a variety of different ways to keep them connected, and for us to be able to communicate with them, including using Slack. We do have a website for not only use of the council, but also that's available in an ongoing resource for the public and for the community. We have definitely been working to utilize the connections that both the council and the core strategy team has, and also literally looking to develop their technical and social media skills, given that we have members of the council that are in their 60s and 70s, as well as, like in their 20s. So again, some of them are expert in some things, and there's areas for improvement. And so we're just finding the benefit of really helping everybody to engage, and that actually supporting their leadership and ability to engage with others. And again, we see the opportunity to really circle back with some of the strategic partners that we've been working with in 2022. Next slide. In terms of our aspirations, we are planning 2 listening sessions or health equity community forums in March and April. We're also planning, after the time frame for the grant, a health equity summit, as well as not only hoping, and I'm hoping that this may be part of what's shared later, that there will be ongoing funding as a part of this grant, but also looking for other sources of funding to support the work moving forward, as well as building towards a health equity academy that would again be a complement to, and also an extension of, this current work. The long-term results that we are hoping for, again, is not only for the academy to be established, but for there to be ongoing and sustainable funding. As a strategy team, and also the conversations we've had with the council, is looking for health and health equity in all policies, minimally in Detroit, ideally also in the state of Michigan, and even having influence beyond. Improved health outcomes for BIPOC communities in Detroit and beyond. And then also Moses has done work in this area, but looking for them to continue to expand and to become even more known for their leadership and partnership in health equity and health justice work. Hopefully we have at least a couple of minutes, so that if there's anything Andrea or anyone else on the team wants to lift up, please join in. Andrea, or anyone else on our team.
Hello everyone. I think Andrea is having issues with her Zoom, but she
Okay.
will be, yes, but I think you've done a good job. Thank you, Chandra.
Thank you, Banke. Any questions or comments for us?
Is the listening session just like a town hall, I'm assuming?
Yes, although it's a
Okay.
little bit more than a town hall, because we do plan to engage them strategically in terms of it being an opportunity to inform as well as to hear.
Okay, so you guys have like data or something available. Okay, I love it. Great, great job.
Thank you. Mhm. All right, thank you.
Thank you. Got comments in the chat from, really loves what y'all are doing out there. So just want to add in some more positive affirmations for folks.
Thank you very much.
Yeah. So next is Genesee. So the Greater Flint Health, I believe Patricia should be here, or no, not Patricia, Lori.
Hi, this is
Yes.
Lori Kunkel. I'm going to be leading this for Nicole today. So looking at our Genesee Regional Health Equity Council, looking at the strengths of our council, we have roughly 22 members to our council. I think as we look at the group, our strengths are, it is a diverse group. They are extremely committed to the work of the Health Equity Council. And they are also very thoughtful in terms of how they are looking at things and having discussions. They definitely do have a great ability to work together. I think we have built a structure of trust amongst our community representatives, the Greater Flint Health Coalition, as well as our consultants, the Power Initiative. We're finding that as we're meeting, the group is having some very open and honest discussions about the work that they're doing as they're evaluating our mini grant applications, as they're looking at data within the community, and they're really bringing out some of the gaps and challenges that as community members they're seeing. This group also has a great deal of experience in dealing with other public health crises. A lot of them have done a lot of instrumental work in response to the Flint water crisis, and they're bringing that experience here as we're looking at issues surrounding health disparities and health inequities. So some of the opportunities as we have begun our work that this group has identified is really, these right here are centered around our mini grant applications, and as we've been going through them. The first is to provide technical assistance to less experienced community organizations for them to develop programming, including grant writing, logic models, and evaluation plans. This will be key, they see, for sustaining the work of community organizations and really building their capacity to do a whole lot more in the future. We have begun to look at data that we currently have available with our Health Equity Council, and they really do want to develop additional data sources for a better understanding of community needs. That was one of the things that I think was paramount in some of the mini grant applications that we were reviewing, is the collection of additional data that would help to inform the work of this group. Next slide, please. And so just looking at the aspirations here for the group, of course, they're centered around the goals and purposes of this grant to really look at a community that's well educated and the preventive measures to reduce the spread and impact of COVID-19. But going beyond that, it is to eliminate the barriers to resources necessary to improve health, especially the health of the BIPOC community. For results, again, the reduction in health disparities observed and related to COVID-19, but then improved awareness and access to resources for all of the community's residents. They see their work focused on our BIPOC community, but they also realize that they have the power to really improve the health overall in the community.
All right. There's still a couple minutes left, so if anyone has questions, feel free to ask those. All right. We will move on to Ingham County. So Jason, or is it going to be Dana?
Dana, did you want me to take this or?
Yeah, sure.
Okay.
Thank you.
All right. Hi, everyone. I'm Jason Blanks with CAHA and representing the Ingham Regional Health Equity Council. Our strengths are diversity and learned experiences, such as community organizing, leadership from local municipalities, and experience serving the BIPOC community. Another strength is our community partners in the Greater Lansing area, that their commitment to health equity as a whole. So my board represents a lot of healthcare partners that have a state mandate to have a focus on health equity. And so they have a vested interest in ensuring that this project is successful in our catchment area, as well as the awardees' commitment to their individual project. Some of the opportunities would be to enhance information sharing, taking advantage of technical assistance, thanks to our wonderful partners at MPHI and DHHS, and deeply supporting our local community, such as our health equity council members, interests and guidance, and identifying key areas of focus. Dana, would you like to add anything before I move to the next slide?
No, you're doing great. Thank you.
Okay, perfect. Thank you. I clicked the button like I have access and control. Next slide, please. Aspirations, seek grant writing opportunities to increase capacity and sustainability. That is one thing where we're trying to work collaboratively with our partners, not just on the Health Equity Council, but actually some of our awardees, just to really figure out what resources are at the table. So this mapping tool is very, very, very near and dear to my heart, and thank you for sharing, because I am very interested in seeing how this can help enhance the work that we're doing. Understanding and improving barriers for grant writing. So looking at the startup and grassroots organizations and what they may experience, and then sharing the impact and lessons learned from the many grant awarding projects. Some of the results that we would like to share would be improved skills and processes to understand grant writing experience, things that work and things that didn't work. So where did we identify some hiccups as we were going through that process of awarding the mini grants? And then are there opportunities for improvements, or did everything go great? So that's one thing we've been assessing internally. Improvement of processes, identifying ways to work with the community. So my partners on this project, we actually sat down with each one of our mini grant awardees and then identified areas of support. So one of our partners stated that they needed some additional like health equipment. So today, I reached out to one of my partners within CAHA, which is Lansing Community College, and they're looking. They have their whole. They have a health and human services arm, and they're looking to basically see what's in their closets, and if they have anything that can help support giving to that local organization, they're going to do so. Another thing is peer-to-peer connection and partnership development. That's something that we started at the very beginning within our grant, because we really wanted to make sure that we're leveraging as many resources as possible. Some of our partners in the area may be working in silos, so really just trying to break down the silo and ensure that we are information sharing and resource sharing is really just taking place within the work that we're doing. Full completion of projects to the best extent possible. So just really, as I said before, making sure that our many grantees have the support that they need to be successful. Already gave a for instance on that, and then obtaining feedback from individuals and organizations involved with the HEC. So community forums to address health equity. So our Detroit partner, I'm stealing your idea for that listening session. So that's all I got. Dana, please feel free, or our new staff member Adam, if anybody would like to share any additional information, please feel free to unmute and share. I guess not. So any questions? No questions? All right. Thank you, Daniel, for the opportunity, and Lindsay.
Yeah. Thank you so much for sharing. I think next will be Kent County.
Hello, can you see me okay?
Yes, thanks,
Hi.
Olivia.
Yeah, of course. Hi, everyone. My name is Olivia Pena. I'm a public health educator and health equity coordinator at Kent County Health Department. And for our Kent County Health Equity Council, a lot of the work that we've been doing, so we did have a little bit of a late start back in October, but we've definitely picked up a lot of momentum since then, and I've had a lot of regular meetings, the majority of the meetings. So we have our Health Equity Council is kind of broken up into kind of 3 different components. So we have a community voice group, which is mainly comprised of community members, residents, community-based organizations, and a group of connectors and navigators. And they really provide kind of a multi-tier or not multi, they really just kind of provide multiple different perspectives and angles on just community perception. And so that's been the majority of what we've been meeting. They meet bi-monthly. There's been some months where we've had to meet a couple more times just to make sure that we're really accomplishing the goals that this group hopes to have. And so far we've had really great participation and interest from that group. So that's been going on from October and then January, we had our systems meeting, which the systems is kind of that other component to this Health Equity Council. So systems includes potential funders, academia, health systems, and they really come together to listen to the priorities that Community Voice has identified. And then our next phase is to develop action teams, which we're currently doing. We have a meeting tomorrow, which we're very excited about. And that's really where the Community Voice group comes together with the systems to co-create strategies and really figure out how to address the priorities that Community Voice has identified. And so getting into just the strengths of this Health Equity Council is really the unity, trust, flexibility, and strong relationships that we've seen formed, both personal and professional. I think after the second meetings, one of the individuals said, it was really refreshing to come into a group where I didn't recognize anyone and felt like, it was kind of new players at the table. And just over the last couple of weeks, we've really, since October, we've really focused on relationship building and trust. And so that really leads into that second strength of consensus building among a diverse group. So we have a lot of, just in the Community Voice group alone, there's about 30 to 35 people, and everyone is representing, different areas and zip codes in Kent County, ethnicities, identities, age groups. So there's a lot of it's a very diverse group of people, and we continue to really pay attention to how we're going to build consensus in this group. But so far, it doesn't come without some difficulty, but I think that the consensus building has come easier because of that trust and flexibility and relationships in this group. Buy-in and participation has also been a strength. Like I mentioned, we had our first systems meeting where that was really kind of bringing everyone together for systems to learn better about the work that Community Voice has been working on and find ways to get involved. And we had really great turnout. A lot of folks came to that meeting, were really interested in trying to figure out how to get engaged with the work. And then another strength, upstream focus. So the Community Voice group and systems are really interested in making sure that we address a priority that's upstream and figuring out how to really make some substantial change. And so the multi-sectoral involvement is part of that upstream focus in order to kind of accomplish those bigger, more long-term goals. Having that buy-in and the multi-sectoral involvement has really been a strength so far. opportunities for growth. We've, like I mentioned, there's been some bumps in the roads. We're definitely kind of in the learning process along with the group, and there's a lot of different, understanding of, public health terms. And so it's been great that our group is so understanding, and we really work together to kind of figure out what the best move forward is. And so just moving forward and utilizing what we've learned so far and kind of having the open line of communication with our partners. We also hope to empower community to take more of a leadership role within the council as we move forward, and hopefully have some long-term sustainable actions in place. But community members taking active roles in leadership could look like action team leaders, facilitation leadership roles. In our most recent meeting, we had 2 people that have been a little bit more quiet or soft-spoken speak in front of about 100 people. And that was really awesome to see some community members taking that initiative and that leadership. And so we really hope to continue that, and that will be an opportunity where we can continue to grow. Asset mapping is another step forward. So we've recently, with the Community Voice Group, they've identified a topic of priority, which is mental health or social and economic determinants of mental health. And so we really hope that this group, doesn't duplicate anything that's already going on. That's been kind of a concern among many of the participants, that they want to make sure that if it's a new idea that we're going with, that it's innovative and not already happening, or that we can kind of bolster what's already happening in the community. And then engaging additional mental health partners. So mental health was identified as the topic, and originally when we started the Health Equity Council meeting just with Community Voice, their goal was to identify a priority or area to focus on. And so we have some mental health partners, but definitely not as many as we would like to. And so as we continue into our strategy and action team phase, we would love to include some experts in the area, and also to both kind of gain that advice and perspective, but also hopefully to learn more about what's already happening in mental health. So if you want to go to the next slide. And then for our aspirations, we really hope to address social and economic determinants of mental health was really what the group wanted to focus on. And so we specifically hope to address access to mental health support and community safety. So currently we're structuring the action teams around that and figuring out, how to create that sustainable structure and have people feel like they can join in a place that feels like it's where they want to put their efforts. And then we hope to collaborate with systems to address the priorities. So we hope for their continued buy-in and participation and eagerness to kind of come on this journey with Community Voice. And then again, we hope to reduce duplication and improve communications across these kind of multi-sectoral involvement. And then we also are currently working on, and we hope to create both long-term and short-term goals. Short-term more so to utilize the funding. And so this is kind of where that strength of consensus building comes in, is, as we get further in the process, there's some things that are harder to gain consensus on. And I think funding has been something that we continue to really strategize on what the best way and most fair way is for the group to decide how they want funding to be utilized. And so that's on the horizon. So our aspiration is really that we would have some short-term goals around how to structure that. And then sustaining
about 45 seconds left.
Sorry. No, you're good. Our long term is we hope to find funding, like everyone else, really sustain the work so we can continue to fund community member compensation. We hope for systems to continue to be interested and to work with community and kind of have this be the standard of involving community in decisions. And then improved communication, and then align this with other initiatives like the Community Health Needs Assessment and CHIP to improve accessibility of data and that it's more reflective of the community. So that's everything. Does anyone have any questions? Or Tracy, do you have anything?
I think you covered it all. Thanks, Olivia.
Yeah.
Thank you. Next is the folks at Judson for the Macomb Regional Health Equity Council.
Hi, everybody. I'm Khadijah, and I believe I just saw Michelle. She'll present for
I'm here.
us.
Sorry, I was muted.
All right.
Would you like to go ahead, Khadijah? Or I can take it.
You go ahead, take it.
Okay, thanks. Hi, everyone. We're from the Macomb Health Equity Council. We are comprised of 16 council members that represent the diversity of Macomb County, and we've been very intentional with trying to reach out to communities that were not represented at the beginning of the council. So we feel really pleased with the members that we have and helping to bring in new grantees. Our program is really structured around 3 different areas. So we're starting with community health workers, and we use some of our mini grant funding to fund this training, where they currently have 22 participants. It's a really extensive training that goes 4 to 5 months, but when they're completed, they'll be certified as health workers, and they will be able to go into the communities to really gather information about what's happening, gather information directly from community members about what their health concerns are. As I mentioned in a question earlier, another piece of that work is developing this multilingual survey. We had, and I mentioned the community health department had done a survey, but they acknowledged that limitation of their own outreach, that they really did not connect with all of the racial and ethnic minority groups that live across the county. And so we thought that would be a really good use of our resources to make sure that we were sufficiently asking all members, what health needs do you have? And so that survey is currently live. We are having all of our council members and all of our grantees disseminate that, but we also have tablets where community health workers will actually be able to gather that information live when they go to health events. And then the third component is our mini grants. So we have 22, I think, mini grants now. We approved another one this week that have a lot of different health events happening where we're going to be able to really start connecting with the community. So we're so pleased with that. We also have received technical assistance from DHHS and our local health departments. And we have a plethora of data that we are going through to figure out how we can best synthesize and then return that in a community report at the end of this grant. So our opportunities are that we feel like we have a number of health events coming up, and that as our community health workers cohort 1 conclude their training, they're going to be able to go out with their tablets and collect that information and do those service linkages right at the event. And we also have been collaborating more with our local health department. So they are really interested in the work that we're doing. And I think that's going to be a long-term part of our sustainability plan, is figuring out how we can continue to connect with them. And they actually have said to us that they want to move toward a model that's more community-based, that's making their services accessible to people where they are. So we're really hoping to kind of push them more in that direction. Can you go to the next slide, please? All right, so our aspirations, we are hoping to launch another cohort of community health workers. That training is currently being planned now. And like I mentioned, with all of this information that we have, we want to synthesize it in a way that's useful to the community and that can inform our long-term plan. So we are developing a community report, and that is going to be a tool that we think will be able to not only benefit our council members and our grantees, but really to facilitate greater partnership throughout Macomb County. We are spending our February meeting talking about sustainability and really looking at how to build that out more effectively. And then we are also looking at developing recommendations around specific social determinants of health. So as I mentioned, we were really lucky to have Nicole and Jasmine from DHHS join us and share information that they had uncovered on social determinants of health. And now we want to figure out how to put that into an action plan to sort of improve those data points. Our results, our goal is absolutely to get more people to receive information about protecting themselves from COVID-19 and reducing spread of the infection. We are training community health workers to go into the community, and really our goal there is just to make health services and referrals more accessible, and ultimately to have our survey be able to reveal those specific health needs and barriers that hopefully our long-term plan will be able to alleviate. So I feel like I rushed through that quickly, but I'd like to pass along to Khadijah if you had anything that you would like to add.
Not, well, I guess just with some of the mini grants that we have been able to disseminate, as Michelle was saying, we're very proud that we've been able to target and have representation on our council from all the different groups stated in the grant. And so even with our mini grants, we've been very strategic about trying to get grants in the hands of community members representing all those different groups. So we have representation from our Arabic and Chaldean partners, our Asian partners, our African American certainly, and multilingual. And one of the things I think is important is, like she was saying, making sure that the surveys are targeting those groups. And so we've been really careful to work with our partners to make sure that we are thinking through that. But what I really was happy about was in our last meeting, we were able to actually map out by zip code where our grants were reaching, and give a visual to our council members of Macomb County as a whole, so that we could be really focused in on what neighborhoods we might be missing, where we were covering, with grants and with outreach, and really break it out. So we had a huge blown up map, and we were able to kind of drill down on that. And that will also be part of our kind of final report out when we're looking at the community health workers going out and targeting different zip codes and areas as well. So.
Thanks, Khadijah. And I think the last thing I'll mention is that we invested in some really awesome swag. And so we have a beautiful logo that is going on bags that have that are filled with health education and information. And also shirts that our community health workers can wear so that people know how to identify them as a resource. So we're pretty excited about that.
Awesome. Any questions for the folks over at Judson? Nicole, just drop in chat. Would you be willing to share your survey? I'm interested to see if we could replicate. So.
Sure, I can absolutely put that in the chat.
Awesome. All right. I don't know about anyone else, but I could definitely use a little more coffee and just a quick stretch break. So if y'all want to take a few minutes and then we rejoin at 2:15. And we'll pick right back up with the rest of the count. just want to welcome folks back. If you've joined us, can you do like a quick thumbs up reaction or something along those lines so I can get a sense of who's back? All right. Yes. Okay. Well, let me. I think we should be able to get back started. So the next group is going to be Access Health from Muskegon. So Shoni or Sam, are you here to go over your slides?
It'll be me.
Okay. Thanks, Shoni.
Hi, good afternoon, everyone. My name is Shoni Blake. I am the Health Equity Coordinator for Muskegon County. I also have an extensive background in community health work, and just listening to you guys, just bringing it all back. So for our council, I would say our strengths for the council is very active and diverse membership. I was very grateful to have support from my organization with recruitment. For Access Health, again, for the coordinator position, I started late too, in late October. So I had to get a jump on everything fairly quickly. So it was nice to have half of the Equity Council identified, and my coworker helped support me to recruit additional council members. The council is very engaged, and they feel that I have been very supportive. So that's I've had an open door policy with them since I started, and that's been very helpful in having transparent conversations with each other about hopes and dreams and successes for their organization and for themselves personally also. We established goals about, I would say 2 months ago. We locked down our priorities for the group, which really helped us to format our letter of support, a letter of intent process and structure. And then we identified with the group also what MPHI resources were available, like the TA resources that you guys have made available to us. I've made available to the council. Earlier on, when I started in October, the council also established rules of engagement. We carry every day with us, and some of the council members have come up to me personally and stated that those rules of engagement had helped us move forward, and just having that open communication with each other and building a relationship with each other. Everyone at the table doesn't necessarily know each other, but that's been very helpful in building those bonds between each council member. And then, like I said before, I do have an open door policy. I find that that's been really successful with the council members, and then just letting them know that I'm available to them as a support person. Open communication channel, we have established Slack as our mode of communication also. To piggyback off, I think Genesee County, we do have one council member that is elderly, and she has identified barriers with using Slack. So I do go above and beyond to make sure that she's included. I just don't use Slack for her because she's identified that that's a barrier. And the voting structure also has improved. Earlier on, I would say the council members struggled just because we implemented a voting structure and not all mini grants have been approved. So just being transparent, again, communicating with each other about goals, and then redirecting, just because I don't want anybody to lose momentum. And the passion projects that the group has come up with is very important. So if it's a way to have them work with each other so that that information could be resubmitted so that it's approved, that's been very successful also. I don't want any other council members to feel like their passion project isn't important enough to be financed or voted to be approved on. So just making sure that they feel supported overall is very important to me. Opportunities, I would say I in the near future will hope to work with the group to create sustainability opportunities for additional funding, because as I made the council aware, the funding is not lifelong funding, so it is going to end soon. So that we need to come up with strategic opportunities to leverage funding for Muskegon County. Approving community awareness. We've worked, one of the priorities established was marketing and branding of the council so that Muskegon County residents and community CBOs would know that Muskegon Health Equity has opportunities available for partnership. And then more resident buy-in. We do have 2 residents that's on the council, but I would like to do a community forum that has to be brought up to the group. We do have a mental health event that's been planned that is going to go into specialized mental health resources in Muskegon County. I would like to engage Muskegon County residents in some type of forum, but that's to be discussed at the next council meeting. So just creating idea generator for them so that to keep the momentum going. And then next slide, please. I would say our aspiration is expanding on community needs. Like I said before, they did identify a mental health event that they want to host, a large event. They identified that they want to look into social emotional needs of the youth of Muskegon County, and that it includes specialized services like access to parent resources and 504 navigation. So they have thought really long and hard about what's important for them and how they want that to be accessible for parents and residents in Muskegon County. Engaging leaders in community more. I would like to have that open forum just to continue that open line of communication and get more buy-in from the residents. As a community health worker, I do have an idea what SDOH's Muskegon County what barriers we have, but I don't want it to come from me. I want to encourage the council members to determine their own priorities and things that social determinants of health that they would like to affect or change. Sustainability, just working with my supervisor in Access Health and the council members to identify potential funding opportunities for sustainability so that we could continue to build on what we started. It's been a really positive interactions between all the council members, and we've been able to approve around 7 mini grants and 3 larger grants. So it's been a really positive feedback and just improvement on our letter of intent and making sure that we are helping Muskegon County be the best that it could be. And then becoming a platform for other communities, just working with Access Health. They've piloted a lot of programs. So I know that Muskegon County have never received health equity funding, and I hold that near and dear to my heart. I want to make sure that I'm being a good steward of my resources and create this platform so that we have this in the future and it doesn't go away. In the past 60 days, we were able to finalize our mission and vision, and I hold this near and dear to my heart just because we do strive to be the primary agency addressing social health inequities in Muskegon County. And if we could continue on all the positive changes we've had, I know that we could continue to change Muskegon County for the better. Thank you, guys.
Anyone have questions for the folks over at Access Health in Muskegon? All right. I'm going to pass it over to the Ottawa Department of Health. Angela.
Yeah, hi, I'll take over here. Hi, everybody. I'm Angela. I'm the grant coordinator at the health department. So strengths for our council, I think we were another group that kind of got a late start. So being able to be connected and engaged as a group with having kind of a really limited amount of time to make those connections, I think has been great. And the conversations with the council, I think too, really from the beginning have been just everyone is very participative. Nobody really kind of stays quiet. We have everybody is very engaged. And we have a very, very diverse group of people, which in a variety of ways, which is incredibly helpful. And we have been very productive in a short amount of time. We really kind of push through these meetings. We meet twice a month also, and our meetings are pretty long. But we do have a meal. We rotate between lunch and dinner time meetings to kind of meet different schedules. But we, I think, take time to like actually enjoy a meal together as a part of our meeting, as opposed to just like eating while there's slides in the background kind of thing. And I think just taking a little bit of time to enjoy that meal together has helped a lot, and to make that make those connections and to really keep everybody engaged. Long meetings also can get drawn on a little bit. So I think having a meal to break it up helps keep that productivity high. Opportunities, again, with our with such a diverse group too, we do have a lot of people with different levels of understanding of all different kinds of community needs, of social determinants of health equity, of COVID-19 and issues. So I think bringing people together and really broadening everyone at the table's understanding of what is out there in the community. And I think someone else had mentioned, I can't remember who it was, someone had walked into their meeting and thought, oh, it's nice to not see all the same faces at the table. I mean, there are a few faces that I recognize around the table at our council, but there's so many that I've never engaged with also. And I've been highly engaged in community for a long time. So I think that's another kind of refreshing thing. So an opportunity on getting everyone on the same page, I think, and really educating some people on all those different things. Also, I think just the experience of coming together as a group in a short amount of time and it really being a productive, enjoyable, successful experience means a lot. We've had a couple people already reach out and kind of mention that this group feels very different than a lot of other work groups that they've been on, and that being a very positive thing. Other opportunities, we're just, we haven't awarded any mini grants yet, but we're very close. We spent our last meeting and we're spending our next meeting really scoring and evaluating the projects that are in front of us. And there's a lot of really exciting stuff. So I think it's really encouraging we've been on such a tight timeline too. I think it's like, get this done. So it's been nice to see all the applications come in and then really feel that sense of what is going to be accomplished in the community because of all this work. I really span out a little bit in their view and see and appreciate, like, this is really going to have a great impact in the community. And then creating a sustainability plan. We haven't really started that yet, but we're working on it. There is an opportunity there. I don't know what that's going to look like yet because of some other things that maybe I'll touch more on the next slide. Yeah, aspirations. So doing what we can with the time we have. I mean, and with that time, doing the best we can to really influence meaningful change in the community. That's with the work that we actually do, and that's with the connections and I think the education that the council members receive. So really we hope that the council members, come from this being much stronger community champions, having a greater understanding of community needs, of community resources, having stronger partnerships, so that regardless of what sustainability looks like as well, that we can really feel good about the work that we've done. Which hopefully then will be the results, right? That we really can have that meaningful change within our council and within the larger community. Yeah, so sustainability is a little bit of a challenge. I don't know what that's going to look like. We certainly hope that there's some potential there, but there is particular challenges in the environment right now in Ottawa County that that we're not quite sure how we're going to tackle. Heather, do you want to, if you're on here, do you want to say anything?
I didn't think it was back. I think I covered it all. Our group is, I think, really excited to do the work, and they're excited to be part of some, like change that they can see. We just went through our mini grant applications, and so they were able to score and get feedback on that, and they were just really excited. We were hoping for 5, and we got 48, and so they were really excited to see that the return on those applications. So yeah, we've been enjoying it.
Any questions for the folks at Ottawa? All right, we're gonna move on to the Oakland Health Department. Lindsay, Nirvana.
Yeah, Nirvana's gonna go first and then I'm gonna hop in after her. Thank you.
All right, thanks.
Hi, everyone. I'm the Health Equity Coordinator working at Oakland County. I actually just started not too long ago, a few weeks ago in January. So looking at Oakland County's council strengths, we have a huge range of diversity among our partner organizations. Each of our partners serves clients from different communities across Oakland County. This allows us to get data and have a better understanding of the needs of different communities across the county. Also, each council member is very passionate about health equity and serving their communities. They are all extremely committed to this council. Each of our partners share the same values and goals as each other in regards to their communities and equity. Our partners are all have previous experiences with public health crises like COVID-19, social determinants of health and equity. Their experiences and knowledge allow our council to be stronger. Because of their previous experiences, the partners are able to collaboratively work together and share data among their communities to ensure all clients' needs are met. They are able to utilize the experiences going forward and kind of know what has worked and what can work in the future. As we continue to recruit community members, we have the opportunity to learn and understand the community's needs from their own perspectives and experiences. There's also an opportunity for an ongoing collaboration among each of our council members where they can continue to work together, even outside of this grant, and discuss their findings to just better understand clients' needs broadly across the county. This will help the council members and their organizations understand their needs as a whole rather than just their own communities that they serve. By working together, we're able to have more education, just more cultural competence on the communities. This also allows for more learning, community building, and community connections. So Lindsay, if you want to go over the aspirations and results.
Yeah, could we get the next slide? Yeah, so like Nirvana said, we have a really strong and dedicated council right now that's very committed to this work. And we're really hoping that with their insight and experience, we can utilize that to really identify gaps in what services exist within Oakland County and also identify barriers that exist to receiving existing services. So we know that we are a well-resourced county, and we want to ensure that we can take full advantage of existing resources and also hopefully as a council work together to create some innovative and strategic solutions where there are gaps. And ultimately, we're hoping by reducing those barriers and creating new strategies to fill in those gaps, we can reduce, obviously, disparities and increase equitable outcomes. We also really hope that, and we've already seen this in, like other councils have spoken to, we're a little bit of a late start council, but in the limited interactions and meetings we've had, we've already seen how excited our partners are to work together and with each other. And so we really hope that there will be potential collaboration beyond this funding period, both as a council, but we also hope that this will inspire additional connections and collaborations, especially among partner organizations, as they're really excited to work with each other. And I think just bringing together individuals who are individually passionate about this, it's exciting to see people connect with other individuals who are passionate about this, when before maybe they haven't met that particular person at that organization who shares that drive. So it's nice to be seeing those connections made. And then through this work, we're hoping to see our council will be working on providing additional SDOH screenings and referrals. So we're hoping that we will see more people, specifically communities of color, getting these screenings and referrals so that they can access resources. So, and hopefully through reducing barriers, we're going to see an increase in resources utilized. And then ultimately, hopefully through our strategic plan, we will see some ways that we can address the gaps that we identify as well. So there will just overall be less gaps and barriers for folks who are trying to access SDOH related resources and services within Oakland County. And that's all we've got. So if anybody has questions, happy to take them.
I don't see any questions in the chat. So I'm gonna go ahead and move on over to the Saginaw County Health Department. Joyce, Tracy.
Okay, here we go.
There we go.
All right, great. Good to be here, and I've heard a lot of great things and very interesting. I think that one of the overarching themes I've heard as a strength is the diversity of our groups. I saw that across the board. And so that's one of our strengths as well here in Saginaw. We have a great cross-section, as I've said, of individuals at our table by race, culture, gender, various religious affiliations, medical, colleges, universities, government, youth serving organizations, CBOs, businesses, schools, so forth. So I think that it is our greatest strength. And I think, as I've heard others talk about, that is an opportunity for many of our agency people have not had opportunity to work with many of the individuals in the community that we know a lot about, but now they're getting to learn who those individuals and hopefully in the future is going to create some opportunities for better information as we do the work that we've been called to do. Now, opportunities for growth and success, our HEC will be going to get out and do some great things, I think, and do it from a comprehensive perspective. We have demonstrated that when this kind of group comes together, they can get things done. And we've started at ground zero. And I think we've been able to accomplish a whole lot. I don't think people really thought we could actually do. And in fact, I think that as we're moving forward, and we'll talk about some of those things that we've accomplished, that we're getting calls from the dean of the College of Medicine at CMU wants to say, hey, I heard about this group. I want to come and join. One of our hospitals contact and says, you know what, I think I want to come and be a part of this meeting. So something's happening in our table that has piqued the interest of those in leadership and say, here's a place where we want to come and get information from the people who are involved and who have to take advantage of these opportunity and services and see what their perspective is. So I think that is very, very exciting. Let's go on to the next slide, please. So our aspirations at the bottom line of this is to improve the health of our community. And we're doing something I heard so many of you are doing. We are doing 11 focus groups. And that sounds like a whole lot, but we have specific reasons why we're doing that. We have identified in particular our African-American pastors. Many of them actually told members not to go get vaccinated. And so we have a focus group that's going to be just with African-American pastors. We're going to get a diverse group of them, male, female, whoever, and we're going to bring them together. And we have created a list of questions that have been helped develop by our university. Saginaw Valley State University has worked with us, as well as one of our members of HEC, who's a former marketing and research developer for Dow Chemical Corporation. And he sits at our table as a volunteer. And so he's come there, and I think we've done an excellent job of putting some pretty open-ended questions so we can gather some data that can improve and inform the way we do business in Saginaw County, praise God. And once our focus groups are completed, our aspirations are to take all of this information and synthesize it so we can come up with what are the challenges and barriers that we need to look at and how we can improve and get rid of those barriers so that we can serve people better in Saginaw counties. One of the results we're hoping for in the future was the continuation of the HEC. In fact, our health director is already talking about, we end after June 30th, they're already talking about holding the HEC together and continuing to meet because there's been a call for our services and they think we have value. And of course, we'll have an opportunity to implement all the results that we think we're going to get, not only from our focus groups that we're going to be having, and I won't go into the details of all the other 10 that I have not mentioned. And we had 20 mini grant applications and we funded 10. And some of them are already in operation and some of them are having overwhelming response to the services they're providing that address the needs that we've identified. That is so exciting. We're having some that are so overwhelmed. We're trying to find additional funding for them to not turn people away in these mini grant opportunities. And we have, in one in particular, I think is so exciting, we have Premier Yoga, which is one of our mini grant recipients, who is now over at one of our local churches providing yoga to church members, and now another church. We're going to be going to a second. That's what it's all about. We're making connections that did not exist in our community before. And to me, that's one of the great values and the results of what the HEC has done. We're going to reevaluate where we are, and then we're going to use these findings to really inform the future work in this community. Because, you know, during COVID, we had some hostile things happened in our community as a result of people not getting the services they needed. So we're going to identify these barriers and challenges, and we're going to confront them and put some things in place that will eliminate this kind of confusion in our community, and we'll have more harmony as a result. Thank you.
All right. Thank you, Joyce. everyone really loves what you're doing. You're getting some notes in the chat that, you know, you're doing a great job. This sounds really fantastic. So
We're
keep up
excited.
the good work.
We're having fun too. We're having fun as well.
Next group is, is going to be Washtenaw.
Good afternoon. It looks like Danielle, there we go. Thank you.
Yeah, they got backwards, but.
Good afternoon, everyone. Chuck Wilson, Washtenaw County Health Department. And our SOAR analysis, as you can see, included a lot of things. And so I'm going to go over them and give you sort of high level comments as to what we had, what you see on your slide, on your screen rather. So let's start with our strengths. We have a long-standing collaboration with the community and the organizations that help put the Health Equity Council together. And so I think that this council not only strengthens that, but it also allowed us to have a larger reach than we would have in terms of recruiting members. Our commitment to equity, we started doing really intentional equity work back in 2012 as a health department. And this Health Equity Council has really allowed us to not only solidify that commitment, but it's also allowed us to sit back and allow the community-driven nature of the council to move us forward. We have, once again, familiarity with community-based mini grant applications and awarding. We were part of building healthy communities, and so that made it a little bit easier for our council members who weren't familiar with a mini grant process to help move them along in the process as well. Our group is very diverse, and it represents the communities that were hardest hit by COVID. And this was really important for us to make sure that we use these resources to address those areas in our county, which is the eastern side of the county, who were hardest hit by COVID, with hospitalizations and unfortunately deaths. And another thing that we're really proud of, and the reason why I'm smiling is because this group was largely chosen by our 3 support organizations. And I think I mentioned that on the last call. So, you know, we all had to get 3 support letters at least as we responded to the RFP. And it was those 3 support groups that actually did the recruiting and the vetting, or the majority of the recruiting and the vetting of the people who are on the council. I mean, if that's not an example of community driven, I don't know what is. We wanted to build on existing COVID outreach strategies that have been effective locally. For instance, using community health workers. Many of you all have mentioned community health workers and the support and the guidance and the leadership that they've provided within your own organizations. Moving on to opportunities. We work with committed and equity-focused organizations and residents. These are folks who are on our council who actually care about the overall health of the people in their communities. And I think that's important. We all do. We increased awareness of issues within the county, and that's what this Health Equity Council is doing. We've had a press release to talk about this Health Equity Council and the work that they've been doing, and we've gotten feedback that would support that, you know, the awareness around around community groups that are working with government groups, how effective and how powerful that can be. We're building a sustainable Health Equity Council, and a number of folks have mentioned the fact that they've already begun their sustainability efforts, and some have said, you know, gosh, we're thinking that it's going to be tough. But as everyone else, we're thinking about life outside of this particular grant space and what that looks like. Based on our many grants submissions, mental health, well-being support is much needed in our communities because of COVID. And I'm sure that this comes to no surprise to anyone that mental health and overall well-being was a huge issue during the pandemic for a variety of reasons I don't need to necessarily go into in this space. And then we had new community connections, excuse me, new connections and first-time collaborations with partners embedded within our priority communities. Once again, our 3 support organizations really did a good job of reaching out and making sure that the people that they recommended for the council really not only were interested, as I mentioned earlier, but also they themselves also had connections within the communities that they live in that we didn't have. Next slide, please. And so our aspirations, I'll go through those quickly. We want to create an environment of collaboration between communities and organizations and with the health department that lasts. And I'm gonna go through these quickly, but I'm gonna park here just for a hot second. And that's that building something that's sustainable in a relationship between community and health departments, in this case, health departments. What that means is that we have to allow those with lived experience to drive these processes. And as many of you all know, that's not always easy, because as a health department or any government entity, we're used to driving resources and protocol and people. Well, we have to learn to share those resources. And the only way that we can create this type of environment is allowing this work to be community driven. Continuing to garner trust with Washtenaw County residents, continuing to break down health equity barriers, support and with funding opportunities. And another one of our aspirations is that our Health Equity Council will lead to more governmental community power sharing that addresses health concerns and needs of our most vulnerable county residents. And that's a huge one for us as well. As I finish up here with results, the Health Equity Council will continue working on community issues beyond the grant funding period. Sure, we're saying that, but this is a direct quote from our Health Equity Council members. So there's some intentionality behind that. Also, the use of grant resources to address the immediate needs in the eastern side of the county, which encompasses the 2 zip codes that you see there, and that the group will continue beyond May and in some way, shape, or form. I'm sorry about that typo there. That should be way, shape, or form. And the reason why that seems so, what's the word I'm looking for here? Nebulous, if you will, is because the Health Equity Council will determine what that looks like as they move forward and how they're going to define sustainability. So that's all I have for today. If we don't have any questions, thank you for listening.
Yeah, thanks so much, Chuck. I am going to pass it over to Minu over at Dabo for Wayne's Health Equity Council.
Thank you, Danielle. It was inspirational and just felt really good to hear everyone's presentation and their efforts today. I plan on being very short to let everyone out as close to on time as possible. So as you know, Dabo is responsible as the BBO for the Wayne Regional Health Equity Council. And as many of you have said today, one of our primary strengths is just the diversity in our sector representation. Our advisory council is extremely knowledgeable. We have people with PhDs, we have pastors, we have a youth, we have a parent, and I just made a comment to Chuck because we echo that the community needs to be the driver of this work, and they are the experts. We are here to support them. We've been having consistent monthly meeting and input from our advisory council members. We've distributed 20 mini grants to date, and we've identified an additional 20 recipients who will receive the second cohort of mini grant funds on February the 15th. Our opportunities that we're really looking at long-term is to really just develop a sustainability plan. Listening to everybody today, I know I talked a little bit or asked, a little bit about the evaluation process, but it makes me wonder as a group, especially dealing with urban areas, for some of you, if there's a way that we can come together to maybe do some type of health equity summit jointly. And then the other opportunity, of course, is just to increase training opportunities for our mini grant recipients. One of the things that we know about COVID is that it gave birth to a lot of new nonprofits and community-based organizations who have been working in the community with members, but not specifically around COVID or those resources. So there are churches now that are heavily involved in this work, and a lot of new recipients. So next slide, please. Aspirations. So, really beyond the grant funding, we want to see if there is an opportunity to expand the number of advisory council members that we have. We could use a little more diversity and representation from some ethnic populations that are not represented at the council right now. And then also providing more mini grant recipients with an opportunity to address priority concerns that they have identified through their assessment. So, whether that is infrastructure within their organization, such as grant writing, or, helping to build the capacity of the organization, or just really to identify other priority health concerns outside of COVID-19 that they need help in coordinating and addressing, specifically through health equity centered policy. And then lastly, in terms of the results, we're looking to make sure that the council is a self-sustaining decision-making body beyond this grant opportunity that can provide training, technical assistance, and resources for community-based organizations to address health disparities in Wayne County. And I'm just excited about the possibility of continuing this work. And again, just thinking about the other opportunities that DABO and other community partners that we know of that are working on health equity centered work, the possibility of partnering with you and the work that you're doing in your community to, really expand on the visibility of the community-driven work that's occurring throughout Michigan, specifically in BIPOC communities and underserved populations. So that's it. It's 2:59. Bam, did it. Told you.
Thank you. We just had like one slide of quick updates to give y'all. I lost my mouse, but Afton, go ahead and unmute, and I'm gonna just find my mouse.
All right, so quickly, so you all can leave because we like to let you leave. Want to say thank you for everybody who assisted us with the panel that we had for the statewide social determinants of health summit. You all were great. We got a lot of feedback from the work that you all are doing. We will have some folks that want to connect with you, so be looking forward to that. The important news is that our overall grant has been approved for an extension. So what that means for you all, more details will be coming, but we will have a sort of continuation application process up and running for you pretty shortly. So more to come, and then you'll have an opportunity to ask more questions at the office hours as well as in your individual meetings that will be coming up soon. So thank you all, because your work is helping us to continue these efforts, and have a wonderful rest of the day. And more importantly, have a good weekend.
Thank you. Keep up the good work, everybody.
Thanks so much, everyone.
That's still 2 minutes.
Sure.
Very well, real quick.
Hold on, let me figure out how to stop the recording really quick.